My name is Heun, I'm a consultant psychiatrist. I would like to talk about Valproate or valproic acid today. Valproate and valproic acid is a medication which is used to prevent epilepsy. However, I will talk about the psychiatric indication, which is acute mania, acute depressive episodes in relation to a bipolar disorder. And usually this is then given in combination with an antidepressant. Usually the medication is also used as a prophylactic medication in bipolar disorder. The mode of action is unclear, as in many medications in psychiatry. Some people say it modulates the voltage-sensitive sodium channels. Other indications might refer to a second messenger system, or there has been some evidence that the bioavailability of GABA, which is gamma-aminobutyric acid, another neurotransmitter, is affected. Sodium valproate or valproate is in different forms. Semi-sodium valproate, which is very common, is a mixture of valproic acid and sodium valproate. However, it doesn't make that much sense to mixture that. Some people say it's chemically more stable. However, from the efficacy, it makes no difference because the valproate is the one which is absorbed into the body via the guts. And for that reason, it's important that we look at the sodium, at the valproate, not at the semi-sodium valproate for the chemical effects. There usually, as many medication, sodium valproate or valproate interacts with other medications which are phenobarbital, phenotine, and antidepressants such as fluoxetine. In these cases, the levels of the valproate can be increased, and with other medication, such as carbamazepine, the levels may go down. If you have other highly protein-bound medication, such as aspirin, this might increase the toxicity because the aspirin can displace valproate from its protein binding sites in the body. Side effects are gastrointestinal upsets, anorexia, and the long term, on the short term, nausea, dyspepsia, some vomiting, diarrhea. It may cause raised liver function test, tremor, and sedation. If that's a major problem, one can either change the preparation, which doesn't make that much sense because the stuff which is absorbed is always the same. For specific symptoms such as tremor, one can try a beta blocker, or for dyspepsia, one could try a histamine 2 receptor blocker. Other side effects are leukopenia, thrombocytopenia, which are reductions of the white blood cells and the thrombocytes, and this might be reversible, but in many cases it's not. In this case, then the reduction of the medication doesn't make that much sense. Interestingly, the appetite can be increased with the medication, and that might lead to weight gain. So other very rare side effects are hepatic problems, pancreatitis, agranulocytosis, polycystic ovaries, and hyperandrogenism. It's my understanding that the reasons for these side effects haven't been properly assessed, and it's very difficult, would be very difficult to understand these. Anyway, toxicity is a problem. However, its medication has a wide therapeutic window, which means from the effect to the toxic effects, there is quite a difference, and you have to overdose quite heavily to have severe side effects. Severe side effects by high overdose include somnolence, being sleepy, heart block, coma, and even death. There are different preparations, as I said, mixture of the acid and the salt, and they're called Convolex, Depakote, Epilem, Epilem Chrono, Epicenta, Epival, and sodium valproate as a generic. Usually, because they just have sometimes slightly differences in resorption, even though the same stuff is resorbed, it makes sense to stick to the medication or the brand you're used to. That's not always necessary in other brands, because it makes no difference which type of medication is given, because the effects would be the same. Here it makes a little bit of less sense to stick to the brand. To start sodium valproate, you have to have a full medical history, full blood count, liver function test, ECG, and the weight. Usually you start, as with many medications, you start with low and divided dosages, and you increase every few days, maybe every week, by 200 to 400 milligrams per day, and you might need coming up to 2,500 microgram, which 2.5 grams. However, if you use it as a prophylactic, it might be difficult to know when the prophylactic effects take place. So sometimes you might have to wait a bit longer to see whether it works as a prophylactic. If you have an acute manic episode that's slightly different, then you can see much quicker whether the medication works, and there's no point waiting half a year for that. If a patient is stable, you might consider giving most of the medication in the evening, depending on the effect of the medication on the individual patients. Just to say in general, if you listen to something like that, you might have to discuss it with your GP, because we can't give individual recommendations, and over the years these might change anyway. So this is not an individual recommendation here. Okay, so if you have medication like sodium valproate, check or the GP has to check the full blood count, liver function test, valproate level, and the BMI every 6 months or maybe in a year. And sometimes it makes sense to check the valproate level a bit more often if someone has using it for epilepsy. And if you have side effects or people who cannot report their side effects, then you have to check the levels a bit more often. There is some major problems in women with valproate because in the period when during the pregnancy, the first trimester, sodium valproate and valproate can cause teratogenic effects on the unborn, and for that reason it's very important that women are informed about that. But I come back to this and will explain this in a different video. I hope this helps and gives you some information. You might read it up in the BNF and other publications if you have any concerns or questions. Thanks for your interest, and have a nice day.